Carried. Motion number 34, Stonewall Health Equality Champions, submitted by Chester and World Community Health. Call on the mover of motion 34, please.
Sorry, Conference, it's me again, Terry here at Chester and World Community Health Branch. Conference, Stonewall are the UK's largest lesbian, gay and bisexual campaign-led charity. They have fought, as we have as trade unionists, hard for the last 2 decades on campaigns such as Section 28, civil partnerships, adoption rights for LGBT parents, and campaigns for workplace protection based on sexual orientation. With strong communication links with all of the UK's major political parties, and with extensive research and campaigns presence, they are a valuable ally in the fight to create a personal, fair and diverse society. As we reach out to recruit people who have not previously engaged with UNISON or trade unions, we need to actively seek audiences who share our values and who can contribute to our work. Stonewall work with thousands of people across the country and volunteers and campaigners, activists, young and all to contribute to their work. And I would argue that they're potential union members if they're in appropriate employers and they're not already members themselves. By working closely with Stonewall, we'll engage more people and further push the fantastic equality work that we're already doing as UNISON. So what work does Stonewall do that we should be promoting and using in our branches? Stonewall this year launched its first National Health Champions programme, working with over 20 NHS trusts in the UK to improve patient care and our workplaces for lesbian, gay and bisexual people. This programme gave employers and diversity teams access to over £6,000 in expert consultancy and a whole organisational audit on how well they're meeting the needs of LGBT people. This work has led to many trusts directly talking to lesbian and gay staff for the first time, improvements of equality monitoring of service users and staff, including how to use that information effectively, and developing LGBT-specific services, training and understanding, and the facts about LGBT patients and staff. Conference, let's be clear that lesbian, gay and bisexual people still face significant health inequalities in society, and they still face major challenges in the workplace too, and shamefully that occasionally happens in our union as well. The key to helping continue to improve these health inequalities and remove the challenges faced in the workplace is the sheer volume of evidence available to us on the demeaning abuse of equalities and discrimination LGBT people face. The extensive catalogue of publication and research and reports carried out by Stonewall, including the largest ever health survey for lesbian and bisexual women and gay and bisexual men, which are all free to use, can be an invaluable resource for all of our representatives. I'm not going to deny that Stonewall has faced its fair share of controversy, from issues over trans equality, only representing lesbian, gay and bisexual, and not trans issues, and as an employer not proactively promoting trade union-led involvement. But as an experienced campaigner who's worked to lobby on numerous campaigns locally and nationally, I don't beat every organisation I work with their history. I'm a transgender woman, and as a young student union vice president and NUS LGBT committee rep, I was a vocal critic of some of the negative issues of Stonewall's past. However, in 2013, I speak as one of their biggest supporters. I speak as a trans woman that has been involved in national roundtable partnership work organised by Stonewall with some of our leading transgender organisations. And Conference, I speak as a diversity specialist working in the NHS, and I couldn't do my job without the wide-ranging and effective resources they provide that help me fight for LGBT patients and staff back in my NHS trust against management. Comrades, colleagues, I have faith that UNISON working more closely with Stonewall will only have benefits for us as UNISON. It will improve trade union awareness within Stonewall as an employer. We will reach out to thousands of new campaigners and will expand our resources and evidence that are able to help us fight for our members and Conference. It will lead to a more accessible NHS for LGBT patients and inclusive workplaces for lesbian, gay and bisexual staff. Stonewall famously said, "Some people are gay, get over it." As unions, let's tell managers some staff are gay, now let's get on with working for equality. Thank you, Conference.